Hi, Nancy with the Care Plan. We are continuing on how to manage catheters. Now, you've seen all the types of catheters and probably wondered, well, if all the urine goes in, where does it come out and how do we contain it? Well, we have a bag that goes on the end of this tip, and I'm going to show you a couple of different types. This is a sterile tip that goes into the sterile catheter so that there's no germs during the time of insertion, and we keep that always connected to maintain as much sterility as possible. Although there is one change in my statement. This is considered a leg bag, and this is for someone who wants to be up and about and doesn't want to drag a catheter bag along with them. They're still able to move about, and it hides the catheter so that they're not showing other people that this is how they're managing their urine. This bag has some buttons that go around this part, and they strap to the leg. So this part is in the catheter, the tubing goes right down through the pant leg or under the skirt and is strapped around the leg. And then whenever it gets full, there's a little valve on the bottom, and you just empty it directly into the toilet or into a container that would then, of course, be flushed down the toilet. You have to make sure that you close the valve so there's no leaking. Very simplistic type of plumbing, basically. And it's really important for us to use on patients who want to maintain as much of their activity as they can during their hospice stay. Sometimes also this is used during the day, and then very carefully it is taken apart and it is put onto a bag. I'm doing this without, of course, clean technique. It is put onto a bag that would go to the bedside. It has much longer tubing. We're going to talk about this in the next video. And it's larger. So as a person is sleeping, all of the urine is being drained out of the body into the bag, and this is put down next to the bed, perhaps into a bucket or on a towel or something, just in case there was a leak. Again, it has an opening. We'll talk about this later, so that you can drain the bag in the morning or as needed. Okay, so now right now we know what a straight catheter is, that we don't use that often in hospice, because generally if we're going to use a catheter in hospice, it's going to stay in. So we've got that. We have the coude that is generally used for a man to get under the prostate with, you can see the balloon. And we have the straight catheter, the most common, often used for women. Okay, let's move on and talk a little bit more about the bag. All of these are on our YouTube site,